Changing to a patient with portal vein thrombosis and cirrhosis. So should we look for thrombophilia in patients with cirrhosis?
You don't have like any suspicion, particular suspicion? No. We have been doing that. We were been doing that in Barcelona for a long time, and we were doing always thrombophilia, and we couldn't find any thrombophilia to justify the measurements from an economical point of view. Most of the patients, they do thrombose because of the rebalance they have in hemostasis, and because cirrhosis is a prothrombotic disease, and it's difficult to find thrombophilia, so the guidelines recommend not to screen all the patients unless you have a suspicion.
Nice. And if the patient is found with the portal vein thrombosis already with the cavernoma, it suggests us that it's a chronic thrombosis. We cannot be sure, but suggests us. In this setting, we still want to coagulate.
So this is a little bit of controversy because sometimes I would say it depends. We have like more and more data suggesting that anticoagulation is beneficial in the setting of chronic portal vein thrombosis. However, if I have a patient with that I diagnosed a cavernoma that probably was there like 10 years and now the patient is completely asymptomatic, I'm not sure what would be the aim of anticoagulation because I know that I won't recanalize the thing. What I would do here is checking for thrombophilia extensively to really make sure that there is like nothing else that can give you more risk of rethrombosis. But sometimes it's not this extreme setting that I'm put in here. Sometimes it's a patient with a chronic that you can see chronic but not that old. Here we have data and we have the French randomized clinical trial using rivaroxaban medium dose and demonstrating how you can prevent rethrombosis in these patients without thrombophilia or without other factors. So we are still learning in selecting the patients that will respond or the patients with high risk of rethrombosis and going more and more to anticoagulation in those patients.
Perfect. We are very excited for the next Baveno next year. Can you give some spoilers of what we can expect to the next Baveno?
Well, I think that we have talked about things that will change. Definitely, how we change, how we anticoagulate patients with drugs. Do we anticoagulate also in the setting of acute portal vein thrombosis when it's time for interventional radiology? How do we assess the response to anticoagulation? Those are things that the Baveno group is working extensively right now, and yeah, I think that those are the data. The factor A, the anticoagulation in the portal vein thrombosis in the chronic setting, those are things that probably will come in the next guidelines.
Thank you very much. We will be there to see Baveno next year.
Of course. Thank you.